everybody for being here. Welcome to NAMI's another NAMI 2020 Candidate Forum. I appreciate everybody taking the time, both our incumbents and our challengers, and we're looking forward to a, how should I put this, a respectful change of ideas and opinions. And I'd like to welcome our virtual audience. We've done these on live in the past and had good attendance. So I know this is a little bit different, but we appreciate everybody's efforts on being here. I want to introduce, I guess I introduce myself first. My name is Jeff Reed. I'm the Vice President of NAMI Yamhill County. And I want to introduce our candidates first. And we have invited the incumbents and the challengers from 5 districts. As I introduce you, please raise your hand so we can associate a name with a face. I know not everybody could make it. That's okay. You know, scheduling and life happens, but I'm going to read off the incumbents and the challengers from each district here. Starting off with the District 10, incumbent state representative of House District 10, David Gomberg, and the challenger for representative of House District 10, Max Sherman. Okay. Incumbent for State Senator, Senate District 12, Brian Boquist. And the challenger for State Senator of Senate District 12, Bernadette Hanson, thank you. Thanks for being here. Incumbent State Representative, House District 23, Mike Nerman. And the challenger for State Representative of House District 23, Sean Scarbo. Thanks, Sean, good to see you. Incumbent for State Representative of House District 24, Ron Noble. Good evening. And the challenger for State Representative of House District 24, Lynette Shaw. Hi, Lynette. And the last but not least, incumbent State Representative of House District 25, Bill Post. And his challenger for State Representative of House District 25, Romero Navarro Jr. Good evening. Good evening. Okay.
There, here we go. I just sent him a message to unmute. I made the first bill last year.
And okay,
Okay.
where are we at?
Jeff, this is Ted. Jeff,
Yeah.
can you hear me?
I can now.
Okay. Okay, it's time to start the meeting. I think you were speaking. You were muted. So make sure your unmuted button is off, and let's begin the presentation.
Okay, I think the candidates heard me, did they not? Because everybody was raising their hands. They heard me.
Okay. Okay. All right.
So Ted, I'm just finishing up some of the introductions, and we're going on to the fact that this meeting is being recorded by the McMinnville Community Media, and it's not live, but it'll be recorded and will be available over the next few weeks. You can find this information at MCM-11.org for their schedule. A couple of other introductions here. Our timekeeper and Zoom expert, Roxanne Wilson. She's going to be helping us out as we go along here. And the program moderator is Ted Urton. Ted, wave your hand there so we can, under Roxanne's name, so that works good. Ted, myself, and Roxanne, we're all board members for NAMI Yamhill County. I don't know how many of you are familiar with NAMI. NAMI is just an acronym for the National Alliance on Mental Illness. We're a nationwide nonprofit organization, and we provide support, help, and education for families of those struggling with mental illness. And we want to thank all you folks for being here tonight. And that being said, I'll turn it back to Ted, and I'll come back in when it comes time for questions.
Thank you, Jeff. We're going to talk very briefly about our program format and 4 easy steps. The forum begins with candidate self-introductions. They'll talk about the geographic areas they represent, why they are running, and describe any experiences they may have had in dealing with mental illness. After these introductions, candidates will be presented with 4 questions developed by the NAMI Forum Committee. After answering those 4 questions, Jeff Reed, our host, will then host written questions from our virtual audience. You'll have a chance to write questions to specific candidates. And we'll conclude the forum with closing statements from our candidates. We're going to review the rules very quickly here. As candidates are individually recognized, we will state their incumbent or challenger status and the House or district they represent. For the speaking order of introductions, questions, and closing statements, candidate names will be drawn randomly. Upon conclusion of a candidate's speaking time, their challenger will be recognized and will speak second. It is a candidate's forum preference to have both incumbent and challenger within a House or Senate district speak separately, yet back-to-back, to better contrast the candidates' personalities, preferences, and positions. Each candidate will speak from either 1 or 2 minutes. Candidates will be notified by our timekeeper 20 seconds prior to the expiration of their allotted time. Comments extending beyond the allotted time will be muted. No campaign signs or visible campaign materials are allowed, just your beautiful image with your name tag and nameplate visible. And again, media members are in attendance at tonight's virtual forum. So I'd like to turn this back to Jeff, who's going to talk to our virtual audience about writing written questions. Jeff?
Okay, turn my mute button back on here. Okay, in the past, we've had kind of an open discussion, open forum for asking questions. That's just not going to work in this type of a environment. So what I'd like for you to do when you, and send me these questions anytime throughout the conversation. At the bottom of your screen, either on the right or out towards the center, there's an icon for chat. And just click on that and it'll say, you say 2 options there, one for everyone, one for my name. Type in your question, then hit the enter key. If you don't hit the enter key, I won't get it. A couple things about the questions. Please make them candidate specific. That way, you know, we really don't have time for a panel discussion for each question. And also, each candidate will get person will get 1 minute to respond, and the challenger will get 1 minute to respond to that. And this allows us for the candidates to speak without interruption. One good thing from the audience standpoint is that the candidates don't know what the questions are. They're gonna be shooting from the hip, okay, all the way through this thing. So that's good. That's good. So there's nothing that's been predetermined. It's just all going to be as they see it. So Ted, back to you.
Okay, we'll go to candidate introductions. Welcome, candidates. We'd like to have you now introduce yourself to us. We'll call your name randomly. You'll have 1 minute to respond. Thereafter, your challenger will be recognized for his or her introduction. Our timekeeper, Roxanne, will notify you when 20 seconds of your allocated time remains. I now am going to draw the first name for our first introduction. Challenger Sean Scarbo. He's running for state representative, District 23. Sean, take it away.
Okay.
Yeah.
Sean, we can't hear you, sir.
Let him know he's unmuted. He just needs to.
Speak up, yeah. Sean, if you could speak louder. Go ahead.
My name is Sean Scarbo.
Like this. Sean, we're unable, yeah, the audio is not working. We're unable to hear you. You're running against Mike Neerman, who is the current state representative, and he is not here. So we will draw another name out of the basket for introductions. Challenger Bernadette Hanson for State Senate of District 12. Please go ahead and introduce yourself.
All righty. First, I'd like to thank NAMI Yamhill County for putting together this very important forum. I am Bernadette Hanson, and I am the Democratic candidate for Oregon State Senate in District 12. District 12 consists of portions of 5 counties: Marion, Washington, Yamhill, Benton, and Polk. So forums like this are important in building understanding of the fact that mental health issues affect people from all walks of life, men and women of all ethnicities, and from all socioeconomic backgrounds. For too long, politicians from all parties have maintained an almost complete silence about mental health. Only in emergencies and at the extreme end of conditions do we tend to talk about the issues. If we want a government that talks directly to the challenges that Oregonians face in their everyday lives, we cannot allow this silence to continue. I know that far too many still suffer in silence, or live in communities with far too few services, or feel isolated and alone. Silences in our culture are hard to break, as our taboos are resistant to being overcome. We can't prevent all mental ill health. And there are no cures for all the conditions, but we can change the culture. We can.
Okay, candidates, it's very important that after your 1 minute of speaking time or 2 minutes, your audio will be unmuted. We have very limited time. Lynette does not, her incumbent is Ron, excuse me. Our next candidate is Lynette Shaw, challenger for state representative position in District 24. Again, describe your geographic area you represent, why you're running, share any experiences you, your family, or friends have had with mental illness. You have 1 minute to begin your introduction. It begins right now.
Thank you, NAMI, for holding this forum, and thank you to all the candidates and to the audience who's joining us here tonight to find out more about the folks who are asking for your vote. My name is Lynette Shaw, and I'm the candidate for House District 24. I'm a small business owner with a public health education and a healthcare background, and I'm running for this seat because I believe the people of HD 24 deserve a representative who will stay in the fight and deliver the help that we need to recover in our district. Rural Oregonians have watched for years as stable manufacturing and natural resource jobs have departed, healthcare coverage grew more costly, childcare resources disappeared, and wages stagnated. The recovery after 2008 economic downturn left a multitude of rural people no better off than they were before. And at the start of 2020, unemployment was low, but if the only job around is barely above minimum wage and addiction and homelessness and now COVID are ravaging your community, it's hard to feel like everything is going great or if things are going to work out.
Okay, incumbent Ron Noble from District 24, you now have a chance to respond. Again, the question is, describe the geographic area you represent, why you are running, and share any experiences you, your family, or friends have had with a mental illness. Your 1 minute introduction begins right now.
Well, thank you very much for hosting this forum. I very much appreciate it. My name is Ron Noble. I'm currently the state representative for House District 24, which geographically is essentially the south city limits of McMinnville all the way up to TV Highway. So it's McMinnville High School and all the agriculture land between there and Hillsborough High School. I'm running because I've had a whole career of public service. And when I ran 4 years ago, I saw a lot of the same things that actually my opponent just described. We had an economic problem. We were still trying to recover from 2008. We had school funding issues and very much issues with people in our society that are marginalized. Just real briefly, my experience with mental health issues really comes from my work in law enforcement when I experienced firsthand the emptying of our institutions without any support in our communities. And I think we're still building that, and I'm still working on legislation to fight that and fully fund our resources. Thank you.
Thank you. Okay. I'm now asking Challenger for State Representative in District 25, Ramiro Navarro. It is your turn to do your introduction. Again, describe the geographic area you represent, why you're running, and share any experiences you, your family, or friends have had with a mental illness. Your 1-minute introduction begins right now.
Awesome. Thank you for putting this together, NAMI, and we really appreciate it. So House District 25 encompasses St. Paul, Newburgh, and Kaiser. Why I'm running is I'm running to represent the veterans. I'm fighting for education, and I'd like to fight for improving environmental services. And so a little bit about me and how I'm familiar with this is I was a combat veteran, or excuse me, I joined the military at 18, was a combat veteran at 19, and an alcoholic by 20. I used drugs and alcohol to cope with my PTSD, and that resulted in some time in prison. I ended up doing 18 months in prison. And after that, what really helped me get on my path to recovery was finding peer support, addressing my mental health issues, and having the supportive services to be able to recover. And that's something that I'd like to champion as their next representative.
Thank you. Ramiro's opponent, State Representative Bill Post, is not here this evening, so we'll go to our next candidate. We've already done Ron here. Incumbent David Gomberg, State Representative from District 10. Are you here, David?
I am indeed. Hello, everyone. I'm David Gomberg, a small business owner and the incumbent representative from House District 10, which stretches from Tillamook to Yachats along the Central Coast and inland as far as Sheridan and Falls City, so parts of 4 counties. You know, mental health is always important, so I'm glad we're focusing on it tonight. But your question was, how have I been affected? I think the real question is, how is everyone being affected right now? Because I think we are in unprecedented times with COVID, with unemployment, with divisions in our community, and most recently in my district and my neighborhood with devastating fires. Stress, uncertainty, and anxiety are off the charts. And if we're going to come through this, we're going to have to be working very hard together to address those challenges and make sure that we're taking care of the most vulnerable in our communities as we come through both the short-term and the ongoing long-term consequences of the mental health challenge.
Thank you very much, candidates. Have we gotten everyone that's here? All righty. Thank you, candidates. We're going to move on to the 4 questions developed by the NAMI Forum Committee. Names will be drawn randomly. You'll have 2 minutes to answer each question. Once you've completed your presentation, your challenger will be called upon right after you to respond to the same question. Our timekeeper, Roxanne, will notify you when 20 seconds of your allotted time remains. I now will draw the name for our first NAMI question. No.
Did you put all those names back?
I did, yes. Incumbent representative for District 10, David Gomberg, you're the first to go here. Here is your first question. Or here is the first question. Where does behavioral health rank among your priorities in case the state faces a 10 to 20% reduction in funding for the new biennium? Your 2-minute presentation begins right now.
Well, I think everybody is drawing a sigh of relief as I try and answer this and they try and think of their own answers. Look, we're in a remarkably difficult budget environment. Fewer people are working, so they're not paying income taxes. Companies aren't selling as much, so they're not paying corporate taxes. They're not even buying lottery tickets because the bars and restaurants have been closed. So we are looking at reducing our state budgets rather than trying to address fully the challenges that are before us. So where does behavioral health rank? It's got to rank high, but there's so many other things that also rank high. Maintaining education, public safety, healthcare in general. It's going to be a struggle as we move forward with so many pressing high priorities. So you asked me, how does behavioral health rank? I will tell you that it ranks right up at the top, because if we can't deal with our behavioral health issues, we're going to have greater challenges in healthcare, public safety, jobs, and on and on. But it's going to be a difficult budget environment for us to address that. I serve on the Ways and Means Committee, so I'm going to be on the front lines of those conversations, but I have not served on the healthcare subcommittees that have put those initial budgets together. So I'm looking forward to your advocacy. I'm looking forward to hearing from the experts that deal with mental health and healthcare funding within the legislature. And I'm hoping that we can come back with some budgets that are going to put us at least in as good a position as we're in, which isn't a particularly good position, and possibly take us to a better place as we struggle with an impossible budget in the next few months.
Thank you. State Representative Gomberg's challenger, Max Sherman, is not here, so we will move on to a different district. Challenger Sean Scarbo is the state representative challenging incumbent Mike Neerman in District 23. We'll hope we will be able to hear you this time. So Sean, here is your question. Where does behavioral health rank among your priorities in case the state faces a 10 to 20% reduction in funding for the new biennium?
Hi. I do believe that there is a way to do this that is actually revenue neutral. And I believe that we have the template for that in ballot measure 110. It does have significant overlap with mental health. There is a funding mechanism in place there that I think is rather novel and is achievable, given that we are already collecting the tax revenue around the marijuana taxation, and that can be allocated towards mental health. To Mr. Gomberg's point, there is indeed going to be a problem with tax revenue, but at the same time, that appears to be a rather stable source of revenue that can be applied to the situation. And if I may, just going back to the missed introduction, my name is Sean Scarbo. I am the challenger for HD 23 against Mr. Mike Neerman. The district runs from the southern edge of McMinnville down to the southern edge of Benton County, incorporating Dallas, Jefferson, cities of Monroe. And I really do appreciate the opportunity to speak here today. And if I may also, my previous experience in encountering mental health issues was as a retired emergency medicine physician, and we'd be happy to speak to that later in any questions. Thank you.
As the challenger scorer mentioned, incumbent Mike Neerman is not here this evening, so we'll move on to another district. Incumbent state representative from District 24, Ron Noble. Again, the question is, where does behavioral health rank among your priorities in case the state faces 10 to 20% reductions in funding for the new biennium? Your 2-minute presentation begins right now.
Thank you very much. You know, this is a question that is not new. This is something we've been wrestling with for quite a while in my role as vice chair of the Committee on Human Services, and then being part of the healthcare committee. You know, it fits right up there. I would have to agree with my colleague. It fits right up there with every other population right now that is marginalized in our society. Addiction recovery, mental health, housing and homelessness, child abuse, as well as maintaining and increasing our ability to educate and provide for seniors and those with disabilities. It's really a matter of prioritization. I think there was a statement about potential new taxes. I think that's an opportunity, but there will still be a lot of fingers and hands in that pot. And the legislature is not good at prioritizing. We're going to have to make some tough decisions and prioritize the people that need a hand up and some help in our society. You know, years ago, I talked about my experience. We put people out in the communities. It's the right decision, but we didn't provide the supports, and we still don't have the supports. We've talked about justice reinvestment to try and decriminalize mental illness. We've talked about early intervention. We have some legislation that we're drawing up now to try and get early intervention and action right away. We're trying to then also come up with new legislation that actually complies with Senate Bill 860 and pay equity and parity. because we passed the bill, but we still haven't done it. So there are things that we need to do, and especially with our behavioral health reinvestment, to ensure that people have access, they have quality care, early intervention, and then get law enforcement out of the mental health treatment and response game. Law enforcement is better suited for critical incidents, not mental health treatment. So it is going to be a matter of priorities and convincing colleagues that we take care of those who need the most help.
Thank you. Challenging incumbent Noble for State Representative of District 24 is Lynette Shaw. I will ask you the same question. Where does behavioral health care rank among your priorities in case the state of Oregon faces 10 to 20% reductions in funding for the new biennium? Your 2-minute presentation begins right now.
Well, prior to our current public health crisis, the healthcare system that we had in place, and certainly our access to mental health care was really woefully inadequate to fully meet our needs here in this rural area. I think I would agree with what's been said so far in terms of where things rank. You cannot balance budgets on the backs of the most vulnerable people in your community. I think it's kind of irresponsible to do that. But there's certainly going to be lots of things that we would have to do to take a look at how budgets are distributed evenly. But one thing I can honestly say that we cannot do is we cannot be in a position where we are losing money out of our budgets. And that's exactly what happened when the legislature walked out of Salem in February. We have a certified community behavioral health clinic, CCBHC, that was operating in Yamhill County. And this is a model of very comprehensive mental health care, and this is something that we had funding for. We had a federal grant, $46 million grant, $60 million total. But that walkout killed that, and that federal money has gone away. So we have lost that money, and we cannot afford to do that. And that's really the very real cause and effect when legislators don't show up to do their jobs. The program was really designed to provide a comprehensive range of mental health, and here we are in a position not to be able to have that, and not to be able to afford to reinstate it.
Thank you very much. We will now move on to Challenger Bernadette Hanson for State Senate District 12. I'm going to ask you the same question. Where does behavioral health rank among your priorities in case the state faces a 10 to 20% reduction in funding for the new biennium? Your 2-minute presentation begins right now.
All righty. First, I just want to acknowledge Ramiro Navarro and thank him for his service, and to let him know how very happy and glad I am that you are here and running. So kudos to you. To answer the question, I guess it's a bit like what Lynette said. You know, we are now experiencing a once-in-a-century pandemic. And prior to this, 1 in 4 people suffer from mental illness. And the mental health system was, as Lynette said, woefully inadequate. Now we are tasked with, or whoever's going to be at the Capitol are tasked with dealing with the aftermath of that and finding relief for COVID. And nothing else can happen until that we deal with it. And in my opinion, I think the behavioral health and mental health issues have to come first. We have to find the monies for that. We have to address them because the reality is there are people behind every one of those numbers. There are people who are suffering out there, and those people who are suffering, you can, open up small businesses, have jobs available, but if they're not able to do that, then, it's not going to work. So for myself, behavioral health care is going to be probably very prominent and number one in for me.
Thank you very much. Bernadette's challenger, the current incumbent, Brian Boquist, is not here this evening, so we'll move on to another district. We're going to have challenger Ramiro Navarro, representing State Representative District 25, ask the last question here, and again it is, where does behavioral health rank among your priorities in case the state faces a 10 to 20% reduction in funding in the new biennium? Your 2 minutes begins right now.
Awesome, thank you. Yeah, so behavioral health to me is a priority. It's always a priority. Behavioral health was something that I had to focus on in order to be focused on my recovery. And so I know how important that is. I don't think that we should be reducing services because as somebody mentioned that we already have reduced services in the community. We don't have sufficient services to be addressing mental health in Oregon. I mean, Oregon ranks one of the worst, or we have the highest prevalence of mental health illness in the country. And that should tell you right now that that's not something that needs to be cut. And then now we have the fires going on. A lot more people are experiencing traumatic situations that can induce mental illness. And so I think that that is definitely a priority. It isn't something that we need to be focused on cutting. And so yeah, that would rank one of my top priorities.
You still have time. Any further comment?
Yeah, let's see what else. So I would like to say that me being somebody who actually works in the mental health field, I work with a lot of individuals. What I've been doing aside from, because I'm not in that seat yet, so one thing that I've been doing is just supporting organizations and networking and seeing how they can support each other to be able to fill that gap, that void that we have right now, because there is a void. And I hope everybody would join me in letting everybody know how we can work together to be able to fill that need in this time that we're all crunching down and trying to strap up our boots.
Thank you very much. Alrighty, candidates, thank you. We now move on to question 2, developed by the NAMI Forum Committee. Again, your names will be drawn randomly. You'll have 2 minutes to respond. Once you've completed your presentation, your challenger will be called upon right after you to respond to the same question. Our timekeeper, Roxanne, will notify when you have 20 seconds of your allocated time remaining. I will now draw the name of our second, the name of the person who will answer our second NAMI question. Excuse me. Challenger Sean Scarbo, State Representative, District 23. Here is the question. What ideas do you have to increase access for Oregon Health Plan members to treatment and services?
Right off the bat, I'd like to speak.
2 minutes start right now.
Okay. To begin, I'd like to speak to actually Mr. Noble's experience in police and law enforcement. I do believe that that is the place where we can generate funds to further support Oregon Health Plan and its mental health endeavors. The rationale for that statement is in the emergency department, and again, speaking to Mr. Noble's comment about a revolving door. Currently, police are in a position where they are forced to act as social workers, mental health evaluators, and they are overtasked. The process was that if police did believe that there was a mental health issue, they would bring that person to the emergency department, whereupon we did a full-on mental health evaluation to see if they were cleared to potentially go to jail. Each time that process occurred, we were basically looking at close to a $5,000 charge for the police officers, for my time, for the nursing time, for the facility time. That charge back to Oregon Health Plan. Simply reallocating resources within the police budgets to put that money towards social work and roving mental health evaluators that are backed by police in case the situation does become a little bit more tenuous is a very good spend because it will immediately turn around and save money for Oregon Health Plan that can be allocated to mental health treatment. I think that if we were to merge that with the proposed structure that is out there for ballot measure 110, we do have adequate financing and funding to address the mental health issues that we are all very concerned about here. Thank you.
Great. Thank you. Challenger Scarbo's opponent, incumbent Mike Neerman in District 23, could not make it tonight, so we'll move on to a different district. Challenger Bernadette Hanson, State Senate, District 12. Here is the question. What ideas do you have to increase access for Oregon Health Plan members to treatment and services? Your 2-minute presentation begins right now.
All right. First, we as a community have to decide that mental health is a priority, that the people who are suffering from mental health issues are important enough to put monies into and create programs for. I agree with everything that Sean said, so I won't repeat that. As far as ideas of increasing mental health services for folks on Oregon Health Plan, one, we need to look at the plan and make sure that there are elements in there that create a parity with medical issues as well as mental health issues. We've got to recognize that it is important and just as important as other medical issues within Oregon Health Plan's policies. But I think even more than that, what we need to do is outside of the legislative session, and that is to create a movement, a movement that advocates for mental health. And that occurs with groups like NAMI, where they educate folks like tonight's forum, where they have groups coming together to figure out what those answers are. And I think once folks, you know, in our community recognize that this is an important issue and how it affects them personally, and to get them engaged, that's when we can actually do some good at the legislature, because we will have a movement behind it.
Thank you. Challenger Bernadette Hanson's opponent, State Senator Brian Boquist from District 12, could not be here tonight, so we'll go to a different district. Incumbent State Representative from District 10, David Gomberg. Here is the question. What ideas do you have to increase access for Oregon Health Plan members to treatment and services? Your 2-minute presentation begins right now.
Well, access to treatment and services this cycle is going to be not up to as much to we in the Oregon legislature as it is to your listeners who are going to be voting very soon on Measure 110, which was referenced earlier tonight. Measure 110 is going to decriminalize a number of addiction-related crimes and instead try and provide services to them out of primarily cannabis and marijuana sales revenues, about $90 million. I will tell you, I'm a little bit conflicted about Measure 110 because I think it's a great idea. But, and I should also say that that marijuana sales have been running ahead of the anticipated income. So the money is there, but don't think for a minute that that money is lying under a mattress someplace. It's already being spent on education and on healthcare and on criminal justice and being sent to local governments. So if we put that $90 million into addiction services, we're going to be taking it out of other programs because we're spending all the money that we've got. So it's an interesting question. Honestly, I would prefer that we took that proposal and ran it through the legislative budgeting process and compared that good idea to a number of other critically important priorities rather than having it stand alone at the ballot box. But again, my point is, if you're looking at a major opportunity, a game-changing opportunity to change the money that we spend on addiction services, largely to people that are on the Oregon Health Plan, and make changes in how we criminalize their other behaviors, then you're going to get a chance to vote on that when you look at Measure 110 in just about another 30 days.
Thank you very much. Incumbent Gomberg's challenger, Max Sherman, is not here this evening, so we'll move on to a different district. Challenger Lynette Shaw, State Representative, District 24. The question is, what ideas do you have to increase access for Oregon Health Plan members to treatment and services? Your 2-minute presentation begins right now.
Well, I believe that we can build a system using existing infrastructure to provide a public option for folks who need care, can get it without worrying about how they might drown themselves in medical debt or have to ration prescriptions or opt out of recommended care. I think Initiative 110 will go a long way in helping with the funding on that, as previously stated. And I think we can leverage cost savings of providing vertically integrated health services in comprehensive, patient-centered, and prevention-focused coordinated care models to lower barriers to care that are the origin of disparities in outcomes. We can start to address things like the very, very costly social determinants of health that are things that are like uneven access to social and economic opportunities and resources, and the quality of schooling, and the safety of our workplaces, and the cleanliness of our water and our food and our air, and the nature of our social interactions and our relationships. So those determinants drive 80 to 90% of our healthcare outcomes, but they only receive about 10% of our targeted funding. So we have a system that's just sagging under its own weight. But we can move toward a value-based care system, which prioritizes keeping patients, mental health patients, healthy outside of the clinical interface, and it gives providers flexibility so that they can incorporate solutions that bring things like nutrition and basic safety and housing to the table in treatment strategies. So you get more equitable, effective, and less expensive.
Thank you very much. Incumbent State Representative, District 24, Ron Noble, you can now give us your response. What ideas do you have to increase access for Oregon Health Plan members to treatment and services? Your 2-minute presentation begins right now.
Thank you very much. You know, there are a lot of issues going on, and this has been a discussion on several task force and work groups that I've been involved in, just in general healthcare. But I mentioned, you know, Senate Bill 860 from the 2017 session. First, we need parity in pay between physical health and behavioral health providers. It's something that's in the law, and we're still working on it. We have an issue that we're dealing with right now. CCOs are being asked to actually take a further cut in their reimbursements. The Oregon Health Authority has notified them that in this time of increasing need, in trying to keep providers, that they're going to start cutting reimbursements. And along with that, you know, my opponent just mentioned the need for social determinants of health. The CCOs are asking to be able to do that locally. So it's community-based and what the community needs are, from homelessness and addiction recovery and all the other social determinants of health. Right now, the OHA is keeping that in-house, and they figure they're the only ones that can determine that statewide for every community, regardless of the differences in the community. I think there's a lot we can do with access to OHA, with access to our CCOs, and allow them to actually provide service that they want to provide. And our own Yamhill County CCO is one of those examples that does a great job, but is always struggling with OHA because they wanted to do something different than what we need in our local communities. So that's just the start. There's a lot we can do.
Thank you. We'll now move the State Representative for District 25, the challenger, Ramiro Navarro Jr. Your 2-minute presentation begins right now.
Thank you. So I believe the question was how to improve access to OHP and some. So I mean, one thing that really stuck in my mind about that was that I know individuals right now who are working part-time because they have to be teaching from home, they have to be taking care of kids, and they're making just enough that they don't qualify for OHP. So one thing that I would like to look at is the qualifications and how can we support individuals right now who've just went through the crisis of their house burning down or just went through the crisis of COVID and they're having to teach from home, and so that they can have access to that healthcare. And when it comes to different services in healthcare, I think that we should look at preventative measures to different types of issues. So an example on that one, I know another individual that uses acupuncture for their pain management. So instead of going to the doctor and advocating for and asking for drugs that do tend to have some side effects, they were going for acupuncture, and it was working out really well for them. And then OHP cut that. They said that they're not going to cover it anymore. So I would look at seeing how we could advocate for preventative care measures so that we're not putting people in a position where they have to turn to those types of medications to be able to deal with their pain management.
Thank you. Thank you, Ken. We now move to the third question developed by the NAMI Forum Committee. Again, your names will be drawn randomly. You'll have 2 minutes to respond. Once you've completed your presentation, your challenger will be called upon right after you to respond to the same question. Our timekeeper, Roxanne, will notify you when 20 seconds of your allotted time remains. I will now draw the first name to answer our third NAMI question. Challenger Bernadette Hanson, State Senate, District 12. Here is the question. What action should the legislature take for the use of body cameras by local law enforcement? Your 2-minute presentation begins right now.
Could you repeat that question again, please? I didn't hear that.
Sure. What action should the Legislative Assembly take for the use of body cameras by local law enforcement? Your 2-minute presentation begins now.
That's a great question. And truth be told, I'm not really sure what action can be done on a legislative level about body cams. What I do know is that it's important that law enforcement has them, that they are used to capture whatever it is that is occurring in order to protect both the victim and possibly the police. But other than that, I really haven't thought much about it. But saying that, I do know where to go, and I know what people to contact, and part of that would be NAMI and the police force in getting answers to it.
Thank you. Challenger Hanson's opponent, incumbent State Senator Brian Boquist, is not here this evening, so we'll go to a different district. Challenger Ramiro Navarro Jr. for State Representative of District 25. The question is, what action should the Legislative Assembly take for the use of body cameras by local law enforcement? Your 2-minute presentation begins right now.
So I think that, I honestly think that that's a policy that should be handled within the departments. If there's anything that the legislature could do, that they could possibly lay out a framework for the type of policy that could get implemented in the different departments. I think that most departments, I mean, I haven't looked at most departments' policies, but I'm just assuming that most would appreciate having those body cameras because it tells the full story. And that's what we want when we're seeking justice, is we want to know the full story. And so, yeah, I would advocate for a possible framework for a type of policy that could be implemented across the state. But aside from that, I'm not sure what else can be done.
Okay. Thank you, Challenger Ramiro Navarro's opponent, incumbent State Representative for District 25, Bill Post, is not with us this evening, so we will move on to a different district. Incumbent David Gomberg, State Representative for District 10. What action should the Legislative Assembly take for the use of body cameras by local law enforcement? Your 2-minute presentation begins right now.
Well, Candidly, you caught me off guard with this question, which is a good thing to do to legislators from time to time. I will tell you that I like body cams. I like them because they protect sometimes the accused, and I like them also because sometimes they protect the police officers, and more information is always a good thing. So what's standing in the way of us moving forward with this good idea that has a lot of benefits? And the answer is money. I did some very quick checking when you asked that question and found out that the city of Portland has put body cameras on the back burner because they're looking at about $2.6 million in expenses to apply them, and they feel that they have higher priorities. I don't know if it's a higher priority or not, but I think it's a good idea, and I'm sorry that they aren't able to take those steps. So I guess as a state legislator, the question would be, am I willing to help pay those expenses? And the answer is, in a very tight budget environment, I suspect that the legislature also would say that there are some other higher priorities that we need to address. So I'm hoping that local communities will make these decisions. I have no idea what it would cost in the city of Sheridan or the city of McMinnville or the city of Newburgh to apply body cameras, or whether they're already being used in some of those communities. Again, I think it would be a good thing. I don't see it being funded by the legislature right now. Perhaps they will surprise me, just as you surprised me with the question tonight.
Thank you. Incumbent Gomberg's opponent, Max Sherman, for State Representative District 10 is not with us tonight, so we will move on to another district. Incumbent Ron Noble, State Representative for District 24. The question is, what action should the Legislative Assembly take for the use of body cameras by local law enforcement? Your 2-minute presentation begins right now.
I am absolutely a proponent of body cams. As a young officer in Corvallis, part of the traffic team, I was actually one of the first in the state to join with a deputy in Multnomah County to start recording and providing training to officers on how to use cameras in the car. McMinnville, when I was police chief, we had cameras in every single car. But Representative Gomberg brings up a good point, because it's not just the cost of the camera, there's the cost of storage. In McMinnville, we have a separate server that, at least we did 6 years ago when I was there, that actually maintained all that data. And we need to maintain it to public records law. So ensure that we have that. So the storage capacity in a place like Portland would be unbelievable in the amount of video. That's part of it's very doable, but it is part of the cost. Some of the things that we're dealing with on the Joint Committee of Transparent Policing, the Judiciary Committee, and then the Governor's Task Force on Police Training is exactly that. How do we ensure confidence, that the public has confidence of what the police officer is doing is actually credible. And cameras are one way to do that. I don't know where the funding will be, but I am a proponent, and if we can make that happen, I think that would be a great thing and a great way to instill confidence back into our communities.
Thank you. Challenging incumbent Ron Noble for State Representative of District 24, Lynette Shaw. The question is, what action should the Legislative Assembly take for the use of body cameras by local law enforcement? Your 2-minute presentation begins right now.
That's an interesting question posed at the legislature level. Again, I think you have to look at funding, but also if you have to look at how effective are cameras. Cameras might be effective in making a general population be more comfortable with police officers, but I think that most evidence would show that that's not necessarily helping with the violence that we're seeing in the streets and violence from police departments into communities of color. So for the most part, I think what we've seen is that a less aggressive approach can reduce violence. And so, cities are experimenting with other models that might be more effective than cameras. Maybe we can rely on municipalities to take care of the cameras, and maybe the legislature can just do something like require it to be turned on. But, if you look at a model that incorporates, it's a very holistic model like Cahoots and Eugene, that can be a template for something that we can use on a broader scale. So it has nothing to do with cameras, but it's something that might work much, much better, specifically with people who are suffering from mental health crisis. And it's a model that actually saves money. And police encounters with folks in crisis, especially homeless people, often end in citations or arrests. And of those homeless people with mental health conditions, many of them will be arrested at some point. So they end up in jail, not in treatment, and not in housing. And that begins a cycle of incarceration that doesn't benefit anybody. So we might be better off spending on other areas.
Thank you. We'll now move to challenger Sean Scarbo for State Representative of District 23. Again, the question is, what action should the Legislative Assembly take for the use of body cameras by local law enforcement?
I support the legislative body. Okay.
I'm sorry. Your 2-minute presentation begins right now. Go for it.
I support the legislative body mandating the use of body cams statewide. The current situation is that they are voluntary, assuming that the police actually have them in place. It is voluntary upon request by the person being detained. And in this situation, especially with mental health issues, those are the very people least likely to have the faculty to request that. At this time, especially with social unrest, what we are seeing right now is, I believe, an increasing need for that type of policing of the police, especially given the lack of trust. That lack of trust is born from people that are taping from the outside of the encounter and exposing at times some significant disparity between what the police are reporting and what is visually apparent in these videos. I believe that it is a sidestep of the police mission to say that we can't afford it in this situation. The police job across the board, and it's always some variation of the theme in their motto, is to protect and serve. They are there to serve the people of the district, the city, county, whatever it may be. To simply say we don't have the money to step up and perform our mission is not acceptable. Thank you.
Thank you. Thank you, candidates. We now move to our final 4th question developed by the NAMI Forum Committee. Again, your names will be drawn randomly. You have 2 minutes to respond. Once you've completed your presentation, your challenger will be called upon right after you to respond to the same question. Our timekeeper, Roxanne, will notify you when 20 seconds of your allotted time remains. I will now draw the first name to answer our final question from the NAMI Forum Committee. From the State Senate District 12 challenger, Bernadette Hanson. The question is, describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
That's a difficult question because there's so many levels to it. I think the first part of it is that we have to recognize that there are people out there with severe mental illnesses who are living on the streets, homeless, and that we do have to find places for them, one, so that they can have a home, but also where they can get treatment. As far as how that's done, again, I think that has to happen with almost a consortium of public interest groups that would include the legislature on a state level, counties, cities and other municipalities and other special interest groups to come together, and that would include maybe some nonprofit organizations, to come up with solutions that way, and to create or get monies that way. It is something that I don't think can happen with just legislation alone, especially with the budgetary constraints that we are dealing with. I think it is an issue that is important, but that has to be dealt with, again, on a number of levels, and to get as many heads in, in figuring out how to take care of this problem.
Thank you. Challenger Hansen's opponent, incumbent State Senator Brian Boquist, could not be here this evening, so we will move to another district. Challenger Sean Scarbo, State Representative for District 23. The question is, describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
To candidate Hansen's point, this does need to be a multi-pronged approach, a mixture of public, private, nonprofit endeavors. The unfortunate reality in this situation is it is not unifactorial. There is, as you pointed out, drug abuse issues. Sometimes there are obviously economic issues. Sometimes it's actually a choice to be on the street as well. So it is not a one-size-fits-all situation. However, we also have a complete lack of affordable housing, including temporary housing that is merged with mental health and substance abuse treatment options. That is an area that absolutely would need to be a focus of this multi-pronged approach. From a legislative perspective, we need to create the structure that allows those various entities to work together and to coordinate. There are actually some endeavors in the Corvallis area that are starting along that route, but they do not have current legislative support to be able to, I think, completely fulfill their mission. That includes the ability to temporarily house people in semi-monitored treatment scenarios, as well as to bridge them back to the community with unmonitored, publicly supported nonprofit supported endeavors. And I would call out the clubhouse endeavor in Corvallis for that. Without that multi-pronged approach, we will not see any advancement on this issue. Again, I would support creating that structure to allow those pieces to work together.
Thank you. Challenger Scarbo's opponent, incumbent State Representative Mike Neerman, could not be here tonight, so we'll move on to another district. Incumbent State Representative, District 10, David Gomberg. Here is the question. Describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
Well, let's begin with this. We've got a housing problem. We've got a big housing problem, particularly in rural Oregon. People that want to live in our communities can't find a place to live there. People that want to work here can't find a place to live here. And that is true in the working community. It's true in the unworking community. It's true in the healthy community. It's true in the less healthy community. Before our budget collapsed, I was chairing the Ways and Means Subcommittee on Economic Development and Trade, which included the Housing Division. And we were able to make substantial increases in subsidized housing programs and affordable housing to try and begin to address some of these statewide challenges. For those efforts, the Housing Alliance of Oregon named me a housing champion. But our housing situation is not getting better, it's getting worse. I got to tell you, in my own district, in the last 20 days, I've lost 300 housing units. That includes 1/3 of the houses on my own street. So we've got a lot of housing challenges ahead of us, and we need to be smart, we need to be effective, and we need to be cooperative in addressing those challenges. And we do that by working cooperatively, not only at the state level, but combined with the county and the city and with nonprofits to come up with creative solutions to this pervasive issue. One of the ideas that I particularly like has been the suggestion to acquire aging hotel and motel complexes and retrofit them to deal with families and individuals, sometimes with substance abuse and other kinds of mental challenges, so that we can get people off the street and safe and within care. So there are options for us, but we need to be creative and we need to work together to make it happen. The challenges are getting larger, not smaller, as we speak.
Thank you. Incumbent Gomberg's challenger, Max Sherman, could not be with us tonight, so we will move on to a different district. Challenger Ramiro Navarro Jr., State Representative, District 25. The question is, describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
So I'd like to start off by saying that you guys are all on the right track as far as when it comes to supportive housing. I lived in supportive housing when I was in my recovery, and there was a holistic approach to it. It wasn't just you had a house and you were healthy. So one thing that was included was we had social service providers that would help us navigate the system to be able to find out if we qualified for food stamps. So then we have that nutrition. We had another, we each went to school, and we had an advisor at school to help us navigate the classes that would help us improve our education. We had an employment navigator that would help us find a job after we completed the 3 months of classes. While we were in that supportive housing, we had to be in AA, we had to be going to our AA or NA meetings to be able to address our addiction. So it really does need to be a holistic approach for this to work. But I think the main issue is housing in general. It's not just, housing for individuals that are struggling. I mean, everybody's struggling right now. So housing needs to be a priority in general, and that includes supportive housing.
Thank you. Challenger Navarro's opponent, Incumbent Bill Close, could not be with us tonight, so we will move on to our final district. Incumbent Ron Noble, State Representative, District 24. The question is, describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
Well, thank you. I, as Vice Chair of Human Services and Housing during the 2019 session, many of the bills that Representative Gomberg talked about started in our committee before heading to Ways and Means. And just to get the numbers out there, we made a historic investment in housing, over $326 million, and specifically $54.5 million dedicated to supportive housing. That money comes out to communities. The Yamhill County Housing Authority, YCAP do a great job. That we need more, but the work that they do is very well in providing supportive housing. I know that this is a priority of the speakers. I've been able to be a part of several work groups on housing issues with supportive housing to deal with homelessness, shelters, and I would expect that we will continue to see housing a priority across the board, both in supply, in supportive housing, in affordable housing, so that we can get people off the streets and into homes. I know that Dr. Scarbo mentioned that there are some people that don't want to be in homes, and that's fine, but there are a whole lot of people that want to be in a home, want a safe experience, want security with food, and that all plays together when you're talking about social determinants of health. You're talking about anxiety with COVID and fires, child abuse, behavioral health, addiction. It's all together. We can't silo them. And so I'm very optimistic that we will see additional resources spent on housing during this next legislative session, and specifically supportive housing.
Thank you. Challenging incumbent Ron Noble for State Representative of District 24, Lynette Shaw. Here is the question. Describe supported housing and the programs you would propose to increase supported housing for persons with a substance abuse disorder or a serious mental illness. Your 2-minute presentation begins right now.
That $54.5 million for supportive housing that Representative Noble just commented on was really, it could have been a really great project and could have brought a great project directly to McMinnville. And I hate to keep harping on this, but that project died because of the walkout. And we can't keep ignoring the real price our community pays when our legislators don't show up to work. It's a real price. And, you know, supportive housing is a really important thing to have, especially when we consider how significantly homelessness and addiction is affecting our communities right now. Everyone needs decent, stable housing. And for the most vulnerable people who have mental illness or chronic health conditions or histories of trauma, it's really a struggle for those people to maintain housing. And I just read something recently about a new and kind of creative type of housing that just opened up in Salem with, it's got a permanent low barrier complex with 6 respite rooms for homeless folks who have been recently discharged from the hospital, 31 units for low-income residents, and then on-site services, all that wraparound services that help those people who are struggling with addiction and with mental health. And those units will cost only 30% of a resident's income. So it's something that's bearable by those people, but it costs nothing for those with no income. So with that housing, officials, you know, in that city hope to be able to break the cycle of homelessness, and we need to do more of that to provide stable and easily accessible care.
Thank you, and thank you, candidates. We have now completed the 4 NAMI candidate forum questions. It's now my pleasure to introduce or reintroduce Jeff Reed, our Vice President of our NAMI affiliate here in Yamhill County. He is going to be hosting the written questions from the audience. So Jeff, make sure you're unmuted and take it away.
All right, thank you. This is kind of fun for me because only I know what you got. So we'll work through this. Ron, I got to say, and correct me if I'm wrong, but you're the only Republican incumbent that's appeared tonight. Is that correct?
I believe that's correct.
I believe so. Well, you drew a little attention on my chat board, so I got a few questions for you, but we won't start off with you. So we'll move on a little bit.
All right.
This question is for State Representative David Gomberg. David, on 9/21, Congress passed the National Suicide Hotline 988. It will not be operational until July 22nd until July of 2022. Got a 2-part question. Do you support the bill and why? And why is it taking 2 years to implement something that's so important?
Well, you said this was a national bill passed by Congress. Now, why Congress takes so darn long to get anything done is well beyond me. But let's say that while they are dragging their feet, that other good people are putting helplines together that you can call right now. And one that comes to mind is the NAMI helpline, which, by the way, is, oh, that's backwards, isn't it? 800-950-NAMI. That is 800-950-6264 is a number that people can call if they've got anxieties, if they need help, if they are looking at difficult choices. We don't have to wait for Congress. NAMI's here to help us right now, and I thank you for that. Again, I serve in the Oregon State Legislature. We try to work together to find common solutions and to our common problems. Congress does things very differently, and I'm really disappointed that they haven't been able to move forward on this critical project.
Okay, thank you very much. The challenger for State Representative of House District 10, Max Sherman, can't be with us tonight, so we'll go on to the next question. This question will be for challenger from for the State Representative, House District 25, Romero Navarro. Please comment on your support or lack of support for Measure 110, which will make small amounts of drugs in personal possession a civil infraction, referring people to the treatment rather than citing them for misdemeanor.
Yeah, I absolutely support not criminalizing addiction. I think that we could be addressing a lot of the issues when it comes to addiction in more proactive ways. When it comes to the cost, I mean, just the cost. So the majority of the people that are incarcerated, or at least a big portion of them, are in there for drugs, are in there for addiction. And it doesn't stop when you go into prison. People don't stop using drugs just because they're in prison. I don't know if I should be sharing that, but yeah, that's, drugs are in prison, and that's unfortunate. So that it's not conducive to recovery. And so I would support legalizing, minor possessions, so that individuals aren't going straight to jail into an environment that's not going to help them recover. And instead we can support them out here with some community-based treatments that could support them and being productive members of society, instead of us having to pay to lock them up.
Okay, thank you very much. Romero Navarro Jr.'s opponent, Incumbent State Representative Bill Post, is not with us tonight, so we'll go on to another question. This will be for Representative Noble. What happened to the $1.5 million House Bill 4212 that were targeted for Yamhill County for a navigation center?
Actually, that's a great question, and that allows me to actually provide some clarification. The $54.5 million that I mentioned earlier, it's actually a 2019 bill. That money did come specific to supportive housing. The $1.5 million for emergency shelters is a different issue that was from 2020. That bill actually was revisited in the short session, in special session, the first special session, with regards to emergency shelters. All of the money for all of the cities in that bill was stripped out of the bill in the special session. So I understand the connection, and I understand my opponent's continued discussion about the walkout, and I'd be glad to talk about the merits of cap and trade anytime. But the reality is that bill did pass. All of the money, because of the financial situation that we are in with COVID, was stripped out of that bill.
Okay, thank you very much. Challenger for State Representative of House District 24, Lynette Shaw, would you like to respond? Unmute, Lynette, unmute yourself.
Again, I apologize for crossing my wires there, but again, I would say it's the same thing. We need to understand the very real issue and the very real risk we take and the very real losses we get when we have representatives that don't show up to do their jobs. And governing by not governing is a risk for our communities. And sometimes that risk is okay, and sometimes it's not. So in the case of the 1.5, now that's gone. We don't have access to that anymore.
Okay. Thank you very much. Next question is for Representative Gomberg again. The Oregon State Hospital is overwhelmed with GEI, or guilty except for insanity, patients, and to the point where it is encumbering civil commitment opportunities or possibilities. What can we do to help reduce that GEI population, or move it through, or provide additional funding for civil commitment?
Well, I'm going to tell you something that that politicians don't readily admit. I don't know. I'm not exactly certain. This is a little bit outside my wheelhouse, but I think we can dig in, and good people can put their minds together and come up with some proposed solutions to that. I have spent time at the Oregon State Hospital as a visitor, and touring and examining their ongoing processes there. I understand the nature of the problem. I don't have any quick answers or solutions to this good question. If the person that submitted it wants to send me an email, I'll take some time and dig in and get them a more detailed answer than I can provide tonight.
Okay, thank you very much. And your challenger, Max Sherman, is not here tonight. And so I'll go on to the final question I have here. And I'm not picking on you, Representative Noble, but I've got multiple questions for this, so I feel like I need to ask it. Okay. And the basic question is, you claim to act in a bipartisan manner, yet you walked off the job in February with the rest of your Republicans. How do you justify this? And you pledge to never walk off again. Now, that question's been, that's just another, there are about 3 different variations of the question, but you know what I'm getting at.
No, it tends to be the theme. The walkout was probably the most difficult thing. You know, it's I've been accused of bowing out when things get tough. I would suggest that life experiences in dealing with persons in trauma, traumatic situations, and stuff that's not the case. One of the things that's difficult to do is when things get tough, sometimes you have to make difficult decisions. Walking out was not an easy one for me, but I can tell you that the majority of my district wanted me to walk out and did not want cap and trade in the form that it was in, either in House Bill 2020 or House Bill 1530. There's a quorum requirement for a reason. That's in business meetings, all kinds of board meetings, and government. And part of that reason is to ensure the minority also has a voice. This simply was a power struggle. The majority in the House and the Senate have the ability to set the agenda. And this can be looked at in 2 ways. We could look, you could look at who was holding what bills hostage, whether or not we were holding other bills hostage or the majority was holding the cap and trade bill hostage. Really just depends on your point of view. The reality is things broke down, and that is a loser for the state of Oregon. The one bright point is that cap and trade in its form, if you look at what California is going through, has some short-term benefits. But right now, the fossil fuel industry and the automotive industry's carbon footprint is actually growing. So the long-term really favors large corporations and carve-outs and disproportionately impacts small businesses. That's the reason I walked out. We will get all of this legislation back on board. In fact, all of the committees that I'm involved in leadership, we've talked about bringing all of that back, both my majority chairs and my minority co-chairs alongside me. So I do work across the aisle. I'm on 8 different committees, 7 different work groups, and in leadership on several of those committees. Thank you.
Okay. Thank you very much, Representative Noble. Challenger for the House District 24, Lynette Shaw, would you like to respond?
Sure, I can respond. I think that bipartisanship starts with staying at the table. And I'm a small business owner. I don't get to choose who I do business with. I don't always agree with who I do business with, but I stay and I manage the conversation, and I work with people to make sure that we have solutions that are not either or, but yes and solutions. They're win-win solutions, and we can do that for our communities. We have, I think, a representative that's beholden to his party and is still, because he received $100,000 just in the month of September from his party. So he's going to be beholden to his party again, and I don't trust that he will stay in the legislature to work for us. And we lose when that happens. As we've seen tonight, we lose. And I don't want that to happen anymore for the people of the district.
Okay. Thank you very much. Ted, that's all the questions we have right now. I'd like to thank the candidates, the incumbents, and the challengers for your respectfulness to each other and for your honest answers. Thank you very much.
Alrighty, I'm back on. Again, thank you, audience, and thank you, candidates. We've reached the last part of our forum, and we're doing very well in time. I want to thank all of you for your candid responses and the fact that you showed up and let us actually move through a rather rocky start to our forum tonight. But thank you for sticking around. You made it an excellent community event. So we've reached the last part of the forum, which is our candidates' closing statements. Names again will be drawn randomly. Candidates will have instead of 1 minute, we're going to give you 2 minutes each to respond. We've got the time, and we'll bring this in right on 8:30 or slightly sooner. So candidates will have 2 minutes to respond. Once the candidate has spoken, his or her challenger will have the opportunity to make their closing statement next. Our timekeeper, Roxanne, will again notify you when 20 seconds of your allotted time remains. I now draw the very first candidate for the closing comments. My gosh. Incumbent State Representative District 24, Ron Noble. Okay, you have 1 minute to provide us with your closing statement. It can be an elevator speech, anything you want to say. Excuse me. Your 2 minute presentation begins right now.
Well, thank you, first of all, for hosting this. This is a mental illness is one of those things that people don't like to talk about, and I don't need to convince anybody here of that. And people like to hide, but it's a real issue, and there is not anybody in any family that's not touched in some way or another with someone who suffers with a mental illness or a behavioral issue. So that I think these forums are very valuable. As we look forward to the next legislative session, I just need to highlight for myself and for everybody here, and maybe this is partially on the bipartisanship. I've had the opportunity to get involved in behavioral health issues and serving on a host of committees and work groups. I currently serve on the work group with Senator Brzezinski and several others for the decriminalization of mental illness. And I think that's an important issue. We've been together for several years. I mentioned some legislation that's being drafted. It's that work group that's putting that legislation together, those legislative concepts. But I also am involved in healthcare and the judiciary committees. And those are both also ones that deal with the laws regarding how we serve people in crisis, and then the laws regarding who should serve people in crisis. There was a comment made about defunding police. I can tell you that I've been in those situations where I've had to sit alongside. The police don't bill Medicaid or anyone else. The real savings there is the hospital time. I know at one point our hospital here in McMinnville had 3/4 of its rooms, its emergency rooms, tied up with people who were on a mental illness watch because there was no place to put them, which provides, ties up resources for other people in crisis, but it's not the way you treat people who have an issue dealing with mental illness and need some help. We have a plan, and hopefully this will come to fruition, where we get early intervention and essentially get a chance to deal with the psychosis early on. We have a plan to get it out of law enforcement. That we have Cahoots is a great job, and my friend Chief Chris Skinner has done a wonderful job down there. That's a program I'm very familiar with. I'd like to see more communities doing that. So I wish I had more time. I could ramble for a long time to talk about all that we need to do to serve our community, and especially our people who are marginalized in our community in a much better way. So thank you for this opportunity.
Thank you very much, Incumbent Noble. Challenging Ron Noble for State Representative for District 24 is challenger Lynette Shaw. Again, you have 2 minutes to provide us with your closing statement. It can be an elevator speech. It can be anything you want to say about yourself. Your 2-minute presentation begins right now.
Well, I want to thank NAMI again for bringing us all here together today. These are really important topics for us to talk about in our community. We're not going to solve everything in the world here tonight for sure, but it's great that we can talk about it and answer questions from the community. Just for myself and for this campaign and the race that I'm in right now, I'm here to offer voters a choice in how they're represented and an opportunity for changing the way that we deal with disagreements when we're making policy. If I'm elected, I'm committed to staying in Salem and representing all constituents in a true bipartisan way by negotiating and working with legislators and the public, regardless of party affiliation. It's what I do in my small business, and it's what I'll do in Salem. Our community really needs to have a seat at the table, and we can only do that when our elected officials are there to do the work. Governing by not governing is really not the answer. And, you know, we can see the situation that we're in right now with pandemic and economics and wildfires, the community pays a terrible price when the legislature is shut down by politics and neglects to pass legislation. So we don't need political games, we need governance. And our lives and our livelihoods depend on it. So we can absolutely move how we deliver this mental health care and protect people in our communities. We can create policy that prioritizes early intervention and improves care for veterans and diverts those struggling with mental illness away from involvement with police and the justice system. We just have to want it bad enough to elect legislators that are willing to fight for it. I'm running this race to be that legislator.
Thank you. Next is Challenger Sean Scarbo for State Representative District 23. Again, you will have 2 minutes to provide us with your closing statement. It can be an elevator speech, anything you want to say about yourself. Your 2-minute presentation begins right now.
First off, again, thank you for putting on this forum. I think it was excellently organized and carried out. To my statement, in the 1960s through the 1980s, we as a country and a state deinstitutionalized psychiatric patients. This was a move that was absolutely necessary because that system was being abused. It was becoming basically a gray zone incarceration system. However, there was a voiced social contract at the time from the politicians that were in power, and that was that deinstitutionalization was going to be followed by funding for services on an outpatient basis. That included things like transitional housing, mental health practitioners, support mechanisms for people. Just because we deinstitutionalized them did not mean that their mental health problems or their substance abuse problems went away. That social contract was broken. It was not followed through on. And over the course of the last 3 or 4 decades, we've seen the building repercussions from that, from homelessness to increased incarceration rates, to, unfortunately, opioid and other substance overdose deaths. The homelessness issue is obviously integrally tied to that as well. And that's because we've neglected that. Those social contracts, those repercussions are coming due, obviously, now during a time that we are dealing with a pandemic. To hear people say that now we can't find the money to follow through on that social contract, I find rather disingenuous. These are the soul and heart of our society. If we are not caring for those who are not able to care for themselves, we do not have a society. So we either put the money into these support mechanisms in accordance with that social contract, or we are going to continue to see these problems blossom and grow. And unfortunately, everything that we've talked about here has simply been a matter of throwing money at it as opposed to finding the savings associated with dealing with the problem. Those savings are there, and it is time for us as a community and as a state to address those. Thank you.
Thank you. Challenger Scarbo's opponent, incumbent State Representative Mike Neerman, could not be with us tonight, so we will move on to a new district. Challenger Bernadette Hanson, State Senator, District 12. Is Challenger Hanson still here? Okay, then we'll move on to a new district. The incumbent challenger of District 12, Senator Brian Boquist, could not be here this evening. Next one, Challenger Ramiro Navarro Jr., Challenger for State Representative, District 25. You have 2 minutes to provide us with your closing statement. It can be an elevator speech, anything you want to say. Your 2-minute presentation begins right now.
Yeah, thank you, NAMI, for putting this together. We all really appreciate it. I'd like to continue with sharing a little bit about my story. So I already talked about having that supportive housing that helped me out with my recovery. After that, I went to college. I was elected representative on the student government, the veterans representative on the student government. After that, I went on to start the Oregon Veterans Youth Challenge, and that's a group that we put together every summer, me and a bunch of vet buddies, and we teach youth the benefits of pursuing a higher education, either through the military, college, or trade school. And that's because of my passion for education. After that, I continued serving in the community, and now I teach veterans how to support other veterans who are struggling with mental illness. I'm really active in the community when it comes to humanitarian stuff, like during the COVID response, we were able to translate a bunch of information to support the Latinos that were impacted disproportionately. And that's just one person that was offered the opportunity to recover. Imagine if we gave everybody the same opportunity to recover. I know a bunch of great leaders who have a similar story to mine. And so I'm really passionate about addressing mental health issues appropriately. And I want to thank NAMI for being right there alongside me.
Thank you. Challenger Ramiro Navarro's opponent, Incumbent Bill Post, could not be with us tonight. So we'll move to our final district, Incumbent David Gomberg, State Representative, District 10. You have 2 minutes to provide us with your closing statement. Can be an elevator speech, anything you want to say. Your 2-minute presentation begins right now.
Well, thank you so much to NAMI for hosting us tonight and for asking important and difficult questions. In one case, a question that I didn't have an answer to. I also want to thank all the candidates that showed up tonight to deal with those important questions. And I'm disappointed that not every candidate, and certainly not every incumbent in Yamhill County, was able to join us. You know, I started the evening talking about the challenges of 2020. The pandemic, unemployment, riots, and most recently, fires. I believe that someday we'll tell stories about the year 2020. And how those stories end will depend on our ability to bridge the divides that so often have challenged us here in Oregon, between rural and urban Oregon, between red and blue Oregon, between older and young Oregon, or new residents versus long-term Oregonians, or even between people that are financially comfortable and those that are financially struggling. If we can bridge those divides, we're going to come through these challenges stronger, more effectively than we were before. And that's so critically important. I want to thank the voters of House District 10 for honoring me with the responsibility to represent them in the Oregon legislature. And when I return, my priorities there are going to remain healthcare and mental health, jobs, creating not just more jobs, but better jobs, education for our schools and community colleges, taking care of our retirees and older Oregonians, finding more housing, protecting our wonderful environment, and finally beginning to better address the potential for natural disasters here, particularly on the Coast Range and along the coast. So many of the challenges that we're facing these days are inherently involved with the mental health issues that we've talked about tonight. So I want to thank NAMI not only for bringing us together and asking us those hard questions, but for the work that they do every single day. And I didn't know I was going to be asked a question about a hotline earlier, but I pulled this number up so that I could use it in my closing remarks and say, if people have challenges, if people have concerns, if people need help, call NAMI because they're there to help you. It's a wonderful service. And I thank you for the good work that you do, not just tonight, but every single day. So keep doing good things. Thank you so much to all of our listeners and to NAMI for hosting us tonight.
Thank you, candidates. Thank you, virtual audience. It's now my pleasure to reintroduce Jeff Reed, our NAMI Yamhill County Vice President, for some concluding remarks. Thank you all. Take it away, Jeff.
Thanks, Ted. Well, again, I just want to thanks for all the panelists here tonight, and Challenger Ramiro Navarro, I just congratulate you on your success, on your recovery, for the things it's greatly appreciated. Representative Gomberg, thanks for the NAMI plug. We appreciate it. And we hope we're always We never turn down phone calls. We never turn down inquiries. That's why we're here, to help folks that have that special need. You know, tonight we've heard a lot about how the incumbents feel and the challenges feel about mental illness, and about healthcare, and the struggles we all have with funding. So I want to thank our virtual audience. There's quite a few of you signing in tonight. We really appreciate that. And I'm going to leave you with just 3 words. First one is vote. Second one is vote. The third one is vote. That's the most important things we can do going here forward. Thank you very much.